Remove the protector by pulling it straight out. Be careful to avoid contact between the needle tip and the protector during removal. Under ultrasound guidance, confirm the vessel and needle tip while puncturing. Stabilize your hand or fingers on the patient's skin for better control. Once the needle tip enters the vessel and blood return is observed in the catheter, reduce the puncture angle and advance the assembly by 1 to 2 millimeters so that the catheter tip enters the vessel. While firmly holding the main grip, advance tab 1 approximately 10 millimeters to insert the catheter into the vessel. Set aside the ultrasound probe and continue to hold the main grip securely. Then, using the opposite hand, advance tab 2 to the insertion site, placing the entire catheter length inside the vessel. When operating with one hand, use your index finger to advance tab 2 until it reaches the insertion point. Hold tab 2 in place and promptly withdraw the needle straight out. Pull until the mark on the safety cover aligns with the mark on the grip. After removing the needle, detach the slider hub from the catheter hub and quickly connect the infusion line. While securing the slider tab, separate the safety cover from the slider tab. Fix the catheter hub using a securement device or tape. First, clean the insertion site and fixation area with an alcohol swab. Position the securement device so that the triangle mark on the fixation hub faces the insertion site, and engage the slit of the fixation hub with the protrusion on the catheter hub. Slowly peel off the release liner from each side and firmly apply the breathable tape to the skin. After attaching the securement device, cover the insertion site and securement device with a transparent dressing. To remove the securement device, first remove the dressing film. Then, moisten the edge of the breathable tape with an alcohol swab while lifting it. Continue folding back the tape and moistening the adhesive surface as you gently peel it off from the skin. Do not touch the slider tab when removing the protector. Contact may cause the catheter to cover the needle tip, making puncture impossible. Do not tilt the protector during removal, as this may cause the needle tip to touch the protector. Always remove it straight, avoiding contact. Do not move the slider tab back and forth before puncture. This may damage the catheter. If the slider tab contacts the ultrasound probe while advancing, do not force it forward. The needle securing the vessel may dislodge. Do not lift or bend the slider tab while advancing. This may compromise the safety cover's needle protection. Do not stop halfway when withdrawing the needle, as blood may leak from the side hole or valve. Do not rotate or angle the needle during removal. Ensure the securement device is not applied in the wrong orientation. When attaching the securement device to the catheter hub, avoid deforming the fixation hub by applying excessive force.